Hello, my name is Francesca Calabrese. I'm SWGI's Registered Dietitian with a master's degree. I am the Clinical Director of the Southwestern Nutrition Center.
Hi, I'm Dr. Fraser Stokes. I'm a board-certified gastroenterologist, and I'm the Medical Director of the SWGI Nutrition Center. We're here to talk to you about our new medical weight loss program called Ideal Protein. What is Ideal Protein?
Ideal Protein is a 4-phase medical weight loss program. There is a beginning, a middle, and an end. The diet consists of a low-carb, low-fat, and adequate amount of protein to preserve muscle mass. This is strictly diet-based, there are no suppressants or stimulants, and all of your appointments are one-on-one with the dietitian.
Fran, what are dieters asked to do in this program?
During phase 1, the weight loss phase, the dieter is eating 3 Ideal Protein packets for breakfast, lunch, and an evening snack, along with 4 cups of vegetables and green salads. For dinner time, they are asked to eat an 8-ounce whole protein, which could be chicken, beef, or fish. The dieter is also taking nutritional supplements to maintain proper nutrition. The dieter will meet with the dietitian weekly, and when dieters reach their goal weight, they move on to phases 2 and 3 where they start tapering off the program.
Francesca, does the program contain a major emphasis on maintenance of weight loss?
Yes, maintenance is our priority. Our maintenance dieters will attend a free workshop. They still have unlimited access to dietary advice, and they are always welcome into the clinic. Dr. Stokes, can you review our clinical experience with Ideal Protein here at SWGI?
Sure, Fran. We've treated over 100 patients for medical weight loss with Ideal Protein. We're typically seeing women losing about 2 to 3 pounds a week, men losing about 3 to 4 pounds a week. We have one gentleman so far who has lost 123 pounds. So we've had wonderful experience with the program.
Dr. Stokes, how does the program work physiologically?
The program works because the diet is a low carbohydrate diet with adequate amount of protein. So by lowering the carbs in patients' diets, the patient's pancreas secretes a low amount of insulin. When the patient has a low amount of insulin in their system, they go into a fat burning mode instead of a fat storing mode. And so the weight that they lose is almost all from losing fat. So they lose weight in their abdomen, in their neck, and all the areas where they have been depositing fat, and they maintain their muscle mass. So they look more athletic, they don't look sick, and they maintain their strength.
How does Ideal Protein help with medical problems tied to excess weight?
Well, that's a great question, and it really is a testament to the power of the program, because as people lose the weight and they lose the fat, a lot of their medical problems tied to excess weight improve. For example, their blood pressure often gets better and they can get off of some or all of their blood pressure medicines. Their diabetes usually gets better. Frequently, they can drop their dose of their diabetic medicines and sometimes even get off of some of their diabetic medicines. Likewise with the high cholesterol problems, acid reflux, sleep apnea, all of these issues, even chronic arthritic pain related to problems like back pain, all these problems frequently get better as patients lose weight. And that's why it's such a gratifying experience to be able to help patients lose weight in this program. Fran, can you tell us a little bit about the actual Ideal Protein products that patients will be eating?
Yes. There are over 70 different types of Ideal Protein products. We have omelets, we have shakes, we have smoothies, we have chips, and we have bars. We also have a wide range of flavors: chocolate, vanilla, barbecue, garlic and herb, white cheddar. Everyone always seems to find a favorite.
Francesca, are there different ways to obtain Ideal Protein products?
Ideal protein products are only available through clinics such as SWGI Nutrition Center. SWGI is the main Ideal Protein clinic in our area. There are over 4,000 clinics in the United States. You will not find Ideal Protein products online, only through medically supervised clinics. Dr. Stokes, how does alcohol and exercise fit into the Ideal Protein program?
Well, when patients are in the weight loss phase of the program, they're not allowed to have alcohol. When they're in the maintenance phase, they are allowed to have alcohol. In regards to exercise, we encourage patients to exercise from a cardiovascular standpoint in kind of a light manner. In the first couple of weeks, we don't want them exercising at all. We do encourage mild to moderate resistance training, like weightlifting, during the program, but we do not want patients to do extreme exercise during the program, and the weight loss that patients will achieve has very little, if any, to do with exercise. So many patients are losing weight and are not exercising at all.
Dr. Stokes, is this diet safe for diabetics?
It's absolutely safe for diabetics, and it works very well for diabetics. We actually have a specific protocol for diabetics where they are not on quite as low of a carbohydrate diet, especially at the beginning of the program. We've seen many patients, though, have great success that are diabetics. Francesca, how much does Ideal Protein cost?
As of right now, there are no major insurance companies that are covering Ideal Protein. There is a one-time initial fee of $325, which includes a weight analysis, your initial consultation, food journal, a whole month's worth of nutrition supplements, a week's worth of Ideal Protein foods, and unlimited access to dietary advice. The weekly cost for Ideal Protein to purchase 3 products is $84. As you move through the phases, your cost lessens, and you will find that your grocery bill will also lessen 30 to 60% depending on your household.
Francesca, I'd also like to add that this expense is really only for a short period in your life, and we consider it a very major investment in your health. When your patients are on maintenance, they actually have no actual expenses. Francesca, how do patients enroll in Ideal Protein program?
A potential dieter will attend a free workshop here at SWGI. We will go through a short presentation, question and answer session, along with tasting some Ideal Protein foods. They will then get a health profile to fill out, return to the office, and then I will call them for an initial consultation.
Francesca, is Ideal Protein a hard program to do?
Ideal Protein is not hard at all. It is a structured program, and you are coming in to see the dietitian every week. Therefore, you will be helped to stay on track. The Ideal Protein food is very tasty. Many people enjoy the chocolate shakes, the banana pineapple drinks, and our chips. You won't be disappointed in the food. Also, one of my biggest complaints is that there's too much food to eat.
Lastly, Ideal Protein can be used for teenagers as well as senior citizens and pretty much anybody in between. We make a very hard effort to keep in close communication with our referring doctors. So when you initially start the program, your primary care doctor will get a letter, and as you go through the program and lose weight, we'll continue to communicate with them about the success you're having on the Ideal Protein diet. We really enjoy helping patients lose weight and get healthy.
Think Ideal Protein might be a fit for you? Ask your medical provider or the checkout staff for the next workshops. We look forward to seeing you there.